and then we'll go on later. So for the next 45 minutes, I'm going to talk about pregnancy diagnosis in dogs, its methods, challenges and techniques, the care and management of a mother during pregnancy, care of newborn puppies and failing puppy syndrome. Okay, so there are some basic, for every topic you need some basic information that's very important as far as pregnancy is concerned. Okay? Now there are several aspects of canine pregnancy that's very unique to the species, and that's what we're going to talk about. Okay. Now this is again related to mating. I'm not going to talk about breeding at all, but that again is related to your pregnancy. Time you need to do a pregnancy diagnosis. How early can you do? What mistakes you can come into your practice? So we're going to talk about that. Okay. So just a recap, you need to understand when you're talking about breeding, the most important two stages are proestrus and estrus. Right? Am I right? So normally we say we assume or we think all dogs have a proestrus of 9 days and this dog is entering her estrus on the 9th day. Am I right? That's what we normally do. So when you suggest a breeding advice to a owner, we say, okay, start breeding her on 9, 11 and 13, assuming she enters her estrus of the 9th. Right? Now what I want you to remember here at this point of time is proestrus on an average is 9 days, but it's highly variable, can range anywhere between 0 to 2 days to as long as 25 days. That means a dog can enter her estrus on the 26th day also. Or she enter into estrus on the 2nd day. Without having the proestrus, she can directly enter into estrus also. Both are perfectly normal. Okay? Now estrus again on an average is 9 days, but here too it's highly variable. Ranges anywhere between 0 to 2 days to as long as 18 to 21 days. Okay? So clearly need to understand a dog can come and go out of heat in 2 days, or she can be continuously in heat for 45 days. You're okay with this? Now, based on this duration, coming to our topic, based on this duration of proestrum and estrus, the time of ovulation is also highly variable. It can range anywhere between day 5 to even as long as day 21 of the cycle. So a dog can ovulate on the 21st day also. Keep that in mind. Okay? Now, there are some things that are very, very important as far as ovulation is concerned in the case of canines. Right? Now, for easy understanding, I'm going to take a dog with 9 days of proestrus and 9 days of estrus, and let's see what's happening in that particular dog. So, on the 9th day, this dog is entering an estrus. On the 10th day, you have the LH surge. What is this LH surge? That's the hormone that is responsible for ovulation. You're okay with that? That's universal. All species, all including humans, LH surge is responsible for ovulation. Okay? Now, I said LH surge happens 1 day after estrus. No, it's not again a mandate. Right? So it can happen even 3 days before your onset. So it can happen in proestrus also, or on the day of estrus, or it can happen even 3 days later also. That also is not fixed. But still, for an example, let's say this LH surge is happening on the 10th. Now ovulations normally happen 24 to 48 hours after the LH surge. And again in the canines, all eggs don't come out at the same time. In a cat, it all comes out at the same time. But in a dog, it happens over a span of 4 days. Okay, so let's say ovulation is taking place on 12th, 13th, 14th and 15th. Fine. Now this is just an example. So maybe on the 12th you have 3 eggs, on the 13th you have 4, on 14th you have 4 and 15th you have 2 eggs. Now one more peculiar feature is that at the time of ovulation, these eggs are only primary oocytes. They are not fit for fertilization. Okay, it takes another 2 more days for them to become mature and fertile. So that means these 3 eggs which ovulated on the 12th, they are going to be ready only on the 14th. They become secondary oocytes on 14th. These 4 get ready on the 15th. These, again, it goes like that. So that means when you're talking about, the primary oocytes, they're not fit for fertilization. It takes another 2 more days for them to become mature and fertile. Now, once they become secondary oocytes, they can survive only for 24 hours. So that means these 3 eggs will be available only up to day 15, after which they will degenerate. You get my point, right? So it goes like that. So that means when I have a very narrow window, I have a narrow window starting from day 14 to up to day 18. So that's the time when I need to catch these eggs. Okay. Now, another added advantage in the case of canines is that the sperms can survive for a minimum of 4 to a maximum of nearly 7 days in the 7 to 11 days in the reproductive tract. Okay. So that means given this dog, okay, given the fact that this dog is there, and I'm going to breed her on 9, 11 and 13th as most people do, this dog will definitely conceive because what's happening? The sperms are always going to be alive to fertilize all the eggs. You're okay? Now what happens if this dog is going to deviate from the average? Let's say this dog is having a pro-estrus of 18 days, so the dog enters estrus on the 19th, LS surge on the 20th, ovulation on 22nd, fertilization on 24th. That dog, if I'm going to breed her on 9, 11 and 13, she's not going to conceive. Anyway, we're not here to talk about breeding, so that's a different thing, right? Now, just keep this in mind. So you should be clearly understanding the day of estrus is different from LH surge, is different from ovulation, is different from fertilization. Okay? Your dog may be ready, you would have mated our dog, but this is totally different from the LH surge, it's totally different from ovulation and fertilization. Fine, you okay with that? Okay. So now, most important fact is that all events in canine pregnancy are centered only around the LH surge. Fine? When I say you need to do a pregnancy diagnosis at 45 days and a radiography at 45 days, it means 45 days from the LH surge, not from the date of your mating. You okay with that? If I say the gestation period is 63 to 65 days, it means 63 to 65 days from LH surge, not from your date of mating. Please understand this. So every event in pregnancy, when I say I can do an ultrasound as early as 17 to 20 days, I can see the vesicles, it means 17 to 20 days from the LH surge, not from your date of mating. Okay? I'll explain this to you. The next question you'll ask me is, then how do I do the LH surge? I'm not going to talk about that, right? Okay? I give you solutions for everything that I'm going to talk about. Fine. So, the most important, so let me give you an example for this case, right? So, you'll understand better. So, let's say this dog, she's as usual, you're breeding her in pro-estrus, right? So it's very funny, you'll say, how can you breed a dog in pro-estrus? That's what most people do. Because their assumption is this dog is entering in estrus on the 9th day. What they do is they take the female to the male, tie its mouth, breed it, force breed it, and bring it back, assuming a pregnancy can happen. There is a possibility pregnancy can happen. Why? Because the sperm survivability is there for a minimum of 7 to a maximum of 11 days. You're okay with this? So now what happens in this particular case? Let's say this dog is having an estrus. She's entering her estrus only on the 17th. Right? So she has an LH surge on the 18th, ovulation starts on 20th, fertilization starts on 22nd. There is a possibility that breeding could happen, pregnancy, conception could happen. Not all eggs will get fertilized, because by the time this egg is going to become secondary oocyte and its survivability is only going to be for 24 hours, given these facts, all eggs may not get fertilized. So this is also too early or too late a mating is one of the contributing factors for low litter sizes. So a lot of time people will ask you, man, last time she delivered around 12 puppies, this time she delivered only around 10, 12 puppies or 2 puppies, So that's why I said too low litter size. The most contributing factor could be too early a mating, too late a mating also. Okay, chalo. Now, what's going to happen in this case? When are you going to calculate the gestational length, or when are you going to calculate the date of maturation? 63 to 65 days from where? LH surge. But what you will be calculating? You will be calculating from the date of mating. Okay, this is connected to your case in the morning. So you will be calculating the LH, the maturation date from either 9th or 13th, but actually it will be calculated only from 18th. Okay? You're almost 5 or 6 days ahead of this. So what happens is that this dog will deliver by 70 to 72 days from the date of mating, but it will always be 63, 64, 65. That's the rule, because what did I tell you? The puppies need to be inside the uterus for that particular period of time, only then they will attain to maturity. You get it? Okay. So now, what happens to your pregnancy diagnosis? What will you do? So you say radiography at 45 days. You will calculate this 45 days from 13th or from 9th or from 13th. But where are you supposed to calculate? You are supposed to calculate the 45 days from here. So when you are almost ahead by 5 days or 6 days, when you do a radiography, you won't see any fetal skeletons in an X-ray. So you wrongly declare that animal as non-pregnant. This happened to me itself. I'm talking about way back years when I was, I had a dog and I didn't know about all this at all, right? So I took my dog for a pregnancy diagnosis. They say she's not pregnant and she delivered 12 puppies. I was laughing, pneumonia for me itself, you guys did. But then I realized that this is what is the event, right? So the mistake was on me. I calculated the 45 days from mating, not from your LH surge. Fine? Okay. Now the next question. How do I do the LH surge? How do I know when the LH surge has happened? That's automatically you're going to ask me. Don't bother about all that. Your take-home message at this point is that all negatives, either in an ultrasound or in a radiography, needs to be repeated. Fine? That's your take home message. Don't bother about this LH surge and all that. So I do an X-ray at this point. If I don't see any fetal skeletons, repeat the X-ray later. Right? Somebody comes to you for an ultrasound at 17 days or 20 days or even at 30 days. I'm not able to see any fetus. Please ask them to come again after 1 week. And there are so many situations when the client, when he comes after 1 week, you see there's so many puppies there. So that's where again you need to understand it's all related to LH search. Okay. So once you breed this dog, now you've mated the dog. The next question your client asks is, what should I feed her? And should I start her with supplements? Can I vaccinate my dog? Now all these questions come up automatically. Now this calls for an early pregnancy diagnosis. Okay. So I need to do this. So the most important thing again in your practice, always convince somebody to come for an early diagnosis. People come to you at 56 days, they ask you when my dog is going to deliver, what food I can give, what at 56 days, what more you can do at 56 days, right? Okay? So that's why always try to convince for an early pregnancy diagnosis. So now how do I do it? I'm going to do it by abdominal palpation. Now there's a challenge with abdominal palpation because they say that when you palpate, you can palpate the fetus by around 24 to 32 days. There again from the LH search. Now be aware, you can see ping pong ball like swellings. Now after 32 days, you cannot palpate. So there the problem is not because of your skill. The problem is because of the physiology of the dog. The fetus has become much more soft, much more pliable, elongated. So when you'll not be able to palpate at all. So there again a false negative diagnosis. Sometimes you palpate a fecal matter, you say the dog is positive, and there again, so there again positives, false positives or false negatives is a common problem that will happen. So be very careful. Be very careful as far as abdominal palpation is concerned. Now ultrasound is the best method, we'll talk about it next. And then radiography after 45 days. There are sometimes, I told you, fetal mineralization is going to happen at 53 days. So it's always, I suggest a radiography after 53 days. Okay? So if I want to count the litter size, if I want to count the number of fetuses, I always prefer to go for 53 days. And relaxin. Now relaxin is also a hormone, this is test. A lot of people, I was talking to somebody and somebody said, yeah, I'm doing relaxin estimation. Great, okay? Because you can identify the relaxin because it's a hormone, it's placenta specific. So I can identify it from 22 to 26, again from the LH search. Now the disadvantage with relaxin is that you need to understand this is also related to the LH search, right? If it's too early from calculated from your mating, if you're going to calculate from mating, if you do perform a test too early, you can go for a false negative. And sometimes if the litter size is very, very low, then the amount of relaxin that is being produced by the placenta will be too less to be detected by this kit. So you can go for a negative. Now this has happened. I had a sample that came from Goa, okay? Because here I don't need a dog. All I need is a sample, serum sample, and that tested negative. This was I'm talking about way back when I started doing all this. It was negative, tested negative. I said it's negative, and then subsequently the dog went and delivered 3 puppies. So the reasons are maybe there was low relaxin levels or it was not related to your LH search. You get my point onto it? So here with an ultrasound, what I do is, if it's negative, I always tell the owner, come back again after a week or 10 days and repeat the ultrasound. So that's the key point here in this thing. Okay, now ultrasonography, it's not only used to check for pregnancy, but you can also use for viability of the fetus. You are going to calculate the age of the fetus, gestational age, by doing fetal measurements, and you can predict the rate of parturition with that. Okay. Now, giving an allowance for all this LH search should happen. Okay. I don't know when it's going to happen, so I always tell the owner, I can diagnose a pregnancy as early as even 17 to 20 days, where I can see vesicles, I can see the heartbeat by 23 days. Everything is there, but I still ask the owner to come around and other. You're fine with that? Okay, and that's the earliest time when you can do in a practice we can do, right? Now, when you estimate, how do you estimate the age of the fetus? Now, when it's going to be less than 40 days, we calculate the gestational sac diameter, okay? And you have a formula that says gestational sac diameter into 15 plus 20. So that gives you the age of the fetus. Now, days before parturition, that means expected date of delivery is 65 minus gestational age. When it's going to be more than 40 days, you have the head diameter. The formula is head diameter into 15 plus 20. Now that is 6. This is into 15 plus 20. And that gives you the days before parturition. Okay. Now, you need to understand, again I told you before that, when I'm going to do an ultrasound later, in the later stages of parturition, my measurements will not be accurate. Okay, so that's again, keep that in mind. So always encourage early pregnancy diagnosis. Okay, so now estimation of fetal numbers. So most often, all this I'm just trying to tell you because we do these mistakes in our practice, right? So the first thing that the moment you do a pregnancy diagnosis, the next thing the owner is going to ask you, how many puppies are there? Because they're anxious to know about that. Now be honest with them, because that's why I said the challenges and limitation of each technique. You need to understand. Tell them that ultrasound is not a good technique to tell fetal numbers. Okay? I tell them it's not a good technique. It's good to check for early pregnancy diagnosis because you can't do it with any other technique. But fetal numbers. Now what happens is maybe you keep the probe here, you're counting 3 fetuses. You keep the probe here, maybe you're seeing the same 3 fetuses, but overestimation or underestimation of fetal number is a common mistake we make. Okay? So be very careful. Okay? So what normally we do is, in a practice, when you keep your probe, sometimes you see 4 sacs or 5 sacs. We just say 5 plus, 3 plus, 5 plus. Don't go beyond that. That itself will be a problem for you. Because there are a lot of times what will happen is, Doctor, you said 5 puppies, 5 plus puppies, she delivered only 1. Now you need to understand. See, this is where he comes to you almost like an accusing fact that he says you said 5 plus, now there's only 1. Now you can't make a mistake basically in that. See, if you see this image itself, I can see 4 gestation sacs, right? I can say maybe 4 plus. But what will happen is only 1 puppy is delivered. So there again, the problem of resorption, fetal resorption, can happen up to 58 days of gestation. Up to 58 days, the entire bones can get completely absorbed. So partial or complete resorption of the fetus is very, very common in the case of parents, right? So that will lead to disparity in the number that you have, set and the number born. But never make an excuse, okay? Always don't, that's why I said, no, I said there was 7, only 5 was born, maybe that was an absorption. No, that's why I said, first itself I told you, this is not a good technique to talk about fetal numbers. So always tell them, you own it and tell them, I'm not going to talk to you about fetal numbers. Fine, okay? Now, let's go for a radiography. So what's the advantage of radiography? Now I said radiography, you do it, it's at 45 days from the day of LH search. Now this case, this is a radiography at 46 days and where you're not able to see the fetal skeletons properly, clearly, right? Okay. Now another X-ray which is done at 56 days, you can see the X-ray, the image of the fetal skeletons, you can count the number of skeletons, and again what is the advantage is that you can also do the ultrasound at that time. So that is it's a great example of getting the best of both the worlds, right? Both ultrasonography and radiography gives you very, very good information. Now there again, even though radiography is a good technique to talk about fetal numbers, there too it's possible to make mistakes. Especially when there's a big litter size, there will be overlapping of fetuses. So what will happen is that there could be always a mistake, okay? And because this owner is going to depend on you for the number of the puppies that are going to be delivered. He's going to watch for the number of puppies that are going to be delivered. Now always, this is why, keep yourself safe in your practice. Tell them, yes, maybe there's 8 fetuses, there could be a mistake. Always come for a post-well X-ray. So you're safe, right? So whether he comes or not is his problem. But always tell him there could be a possibility of an extra fetuses. So always come for a post-well X-ray. See, being honest at this point of time is always good because it keeps you safe in your practice. Okay. So now let's go for the pregnancy management. So now that the dog is pregnant, now what do I do now? So here this calls for nutrition, improving the nutrition. Now up to 30 days, it's a normal maintenance diet. You don't have to give any extra food for the dog, okay? So up to 30 days, it's a normal maintenance diet. Now after 30 days, it's very important that you start on a pregnancy diet, which is a complete nutrition for both pregnancy and lactation. Fine? Now I'm going to talk about its diet in the sense which contains 29 to 32% protein, 18% fat and 20 to 30% carbohydrate. Now the reason for me to give you this data is that carbohydrate deficiency is one of the most important factors for neonatal mortality. Okay? Now if the mother the nutrition during pregnancy is very poor quality nutrition, insufficient starvation or malnutrition, all this is going to lead to death of the puppies within the first 2 days after their birth. Okay? So that's why we say focus a lot on nutrition. Okay? And so the quality of food that I'm going to give, it should be what is called as an easily digestible source of good quality protein. And see, when I'm going to introduce a new diet on 30 days, no, the dog is already in a zone where its diet, I mean, it's it doesn't have a good appetite. It's down at 30 days, right? So that's why we say, when you're introducing this diet, right, introduce it at the time of breeding itself. Put it on a maintenance level. And then after 30 days, start increasing the diet so that by 45 days, it has 1.5 times its maintenance. You okay with this? Fine. And then you need to, then towards later stages of gestation, you need to split the meals into multiple meals, small quantities and more frequencies, right? Okay. So that's one thing. So now, do I go for supplements? Now the next thing is owners, what multivitamin? So immediately we start prescribing supplements, okay? Now one, you need to understand, now over supplementation or excess overloading of these dogs with minerals and supplements, it's highly detrimental. Fine? Now if the dog is on a commercial diet, please understand this, there is no need for you to feed supplements. There is no need for you to give supplements at all. Be very strong in this, right? Because excess of vitamin A, D, C, they all causes problems with the neonates, which is then going to affect its survival postnatal. You're okay with this? Now again, calcium and phosphorus, that's the area where most of them end up doing, ma'am, I'm giving so much of calcium in the morning, so much of calcium in the evening. That's why I said, when you are on a commercial diet, there is no need for you to give extra calcium. Because your commercial diet contains calcium and phosphorus in the ratio of 1.2:1, which is sufficient to meet the threefold requirement during pregnancy. Fine? Now what happens if I'm going to feed excess calcium? Now why are you feeding calcium? Why do you want to give calcium? What is the reason? What is the purpose for you to supplement with calcium?
Because of the number of any kind of deficiency.
So what's going to happen to the puppies?
Any deficiency to the mother.
Exactly. So people think that I'm going to give calcium because of bone growth. No, puppies is going to take off all the calcium from the mother, right? So in order to avoid a deficiency from the mother, we are trying for the mother. We are supplementing it with calcium, and that calcium is going to get met with by the quality of food that you are going to give. Now what happens if I give excess calcium? Now excess calcium is going to cause gastric dilatation and volvulus in puppies. It's going to interfere with absorption of magnesium and zinc, and again it predisposes the dog to going for eclampsia. So excess calcium is also a problem, or low calcium is also a problem. How much of calcium to give? Now this is where the problem is. You never know how much of calcium. So there, the debate comes, homemade or commercial. Now homemade, how much of calcium is going in a homemade diet, we don't know. That's why always try to advise the owner to go for a commercial diet during pregnancy. Right? I'm not here to talk about any commercial diet at all. It's just that this is the reason why I prefer a commercial diet during pregnancy and through lactation. You're okay with that? Now, I don't know whether this is a good advice or a bad advice. I keep away from trying to prescribe the client with a brand of food. Okay? I mean, that's not fair on my part, because I'm not the reason, simple reason, that's why I said, a lot of things I say because I just want to keep yourself safe in your practice, is that a lot of times if there is an abortion or a resorption, they always attribute it to the type of food that has been given. Okay? So doctor, you prescribe this food. So when somebody asks you what food to give, you always tell them there are so many brands in the market, it's up to you to decide what you. So allow the client to choose the food. Don't thrust any food onto them. This is again, please, there have been situations where food had to be completely removed at a point because they were saying it's causing infertility problems, it's causing death of the puppies and all this, right? So be very careful on those aspects. Okay, now deworming. So when do I deworm my dog? So always deworm it before breeding, okay? And again deworm it at the time, at 45 days of gestation. Now there again, a lot of people advise, no, don't deworm, because if you're going to deworm your dog, there's a possibility it may abort. No, okay? Be very clear, tell them, because when I deworm a dog during pregnancy, the next statement I will always tell them is, nothing is going to happen to your dog because this will not cause any abortion. Now it's a little tough, because when somebody is having a pregnant dog and you're talking about an abortion or a resorption, it's not nice, but again, that's what I say, it's very important, because there are so many situations when an abortion is attributed to your deworming dog. right? So please administer drug. Any drug other than albendazole is perfectly safe during pregnancy. There's another protocol. You can start deworming at 40 days. You can go for fenbendazole. Every day you can go for fenbendazole daily until 14 days after delivery also, okay? Daily you can go for fenbendazole 50 milligram per kg body weight. There's again an excellent schedule for these pregnant dogs, right? Fine. Now this is to prevent toxotarakinase, transplacental transfer of toxotarakinase, which is again a contributing factor for failing puppy syndrome, right? And vaccination. Do I vaccinate my pregnant dog? Normally we don't vaccinate pregnant dogs. Any vaccination that's due, it should be done before breeding. So, or if anybody insists on vaccinating a pregnant dog, make sure the vaccine is a kill vaccine. Are you okay with that? Now, apart from this, the previously vaccinated bitch, even when overdue, is usually not vaccinated. Okay. So now, drugs during pregnancy. Now, what happens is when I'm going to give drugs that are done less than 20 days of pregnancy, it is usually embryotoxic or abortion. During mid-gestation, it may cause internal or externally visible malformations, and more than 45 days, it causes CNS problems in the young one, okay, or cardiovascular system. So, safest group of antibiotics are your cephalosporins. Best is your amoxicillin clavulanic acids, okay. So, I usually go for the amoxicillin clavulanic acid. Fine. Now at 45 days, you need to totally isolate the dog. Isolation doesn't mean one cage to another cage. Isolation means no exposure to other dog, no exposure to other routine people that are just coming and going. So it should be in total isolation. This is to prevent herpes virus infection. Okay. Now herpes virus is a normal commensal organism, and so if you are going to introduce a primate, a bitch which is not exposed to herpes virus, it may pick up the infection, and that causes birth of stillborn puppies, resorptions, abortions, or puppies that die shortly after birth. It's very hard to save the puppies, so it's very important. So in the Europe, there is a vaccine called as Urican, which is available, but it's nowhere available anywhere in the world, right? So now, the other way, that's why I said the only way is to totally isolate the dog during the last 3 weeks of gestation and the first 3 weeks of after conjugation. You're okay with this? Now, I told you at 53 or 55 days, I'm going to do a radiography to check for fetal numbers. Yeah. So now we've gone done with management of pregnancy. So your take-home message, your timeline or take-home message should be at 30 days, go for an early pregnancy diagnosis to check for pregnancy, and then start improving the nutrition so that by 45 days the dog has 1.5 times its maintenance diet. Now at 45 days, I'm going to isolate the dog. This is to prevent herpes virus infection. And by 55 days, I go for a radiography to check for fetal numbers, okay? And most important thing is do a radiography after post-birth, okay? So that's important to rule out any detailed fetuses, okay? So next we come on to our topic. How much of time?
Newborn time.
Okay. So this is care of newborn puppy, right? So when a puppy is born, so what do we do? First remove all the membranes. The mother will take care of it, doesn't matter, okay? But if it's not there, then you need to remove all the membranes, clean the nasal passage, and use a towel to dry and warm. Now warming, I'll talk about all this at a later point, okay? This is just a simple thing. So, and then you examine the puppy for birth weights, and you need to record the birth weight. Now we normally don't do this recording at all, right? Now this is very, very important. You need to record the birth weight almost daily for the first 2 weeks of life, right? Now the reason is that normally the weight gain should be around 5 to 10% daily. Daily weight gain should be 5 to 10% of its birth weight, right? And normally this puppy should gain at least doubles its birth weight by around 10 to 12 days. So that's the rule, right? Now failure for gaining this birth weight is a clear indication that this puppy is going for mortality. Okay? So that's why I said it's again good to monitor and to pay extra attention to that particular puppy. That's why we're talking about, right? So monitoring the weight gain is important because it's the first sign of illness, and what happens is once the puppy starts, low birth weight puppies, they have low viability scores, immunity deficits, low level glycogen reserves, deficiency of thermoregulating mechanism, weaker suckling. They have a very weak suckling reflex, right? Okay. So all this is going to lead to increased mortality rate, right? So now what we do is immediately after the puppy is born, now within 5 minutes we go for what is called as an Apgar score, right? We do a scoring, and we do the scoring based on all these parameters, right? It's very simple. heart rate, respiratory rate, reflex irritability, motility, mucous membrane, all this. So we assign these scores, and any puppy with a score between 0 to 6 definitely needs an attention. Okay? So now it requires added. So we are talking about all this when it's born. It's born immediately, and we are doing all this, right? We're checking for all this, we're doing all this, we're checking the birth weight, we're looking at all this. Anything which has a low score needs to be monitored. Now we also do what is called as the viability reflexes. So where we look for suckling, rooting, writing. So suckling is you put your thin finger and it starts to suckle. Rooting is where you actually put circle your hands like this and you take it towards the nostrils. The puppy actually tends to put its head into this, this one, hands. So this is very important. That's called as rooting. And writing is just put it upside down and it comes back to a normal position. So again, this is a score. This is very important because this gives you a score of again 0 to 4. That means that also that puppy requires immediate attention. Okay. So first I will do the viability score. Then I go for what is called as the other scores. And then now what I do is attention. What attention do you need to give this puppy which is having a problem? You need to support airway patency by suctioning the mouth, immediately suction the mouth and the stomach contents. You can use the bulb syringe which is available, right? You also have nasal aspirators. If not, you can use an infant feeding tube with a syringe. Introduce it, aspirate all the contents out. Okay, so that's very important. Don't swing the puppy. So initially we were taught do this, swing, but that is bad because that could cause cerebral hemorrhage. So it's not good. And sometimes the puppy can slip out of your hands. So be careful on that. So don't do this, but instead you suck out using a bulb syringe or a nasal aspirator. Then support breathing by rubbing, vigorous rubbing on the chest or the back, okay? And stimulate the vocalization. Then if you think you need to give ventilation support, deliver oxygen. And if you think you need to give cardiac support, begin transthoracic cardiac compression. So normally what we do is with your 2 fingers like this, do the compressions, okay? 17 compressions for a period of at least 10 seconds, right? So you need to have somebody to count 17. It's rhythmic, right? Do 17 compressions. Then what you do is hold the mouth in your thing, cup your fingers like this. Cup your fingers and breathe, okay? Don't do long breaths because that's not good for the puppies. Do short breaths, breathe again and then stop and again start doing the cardiac compression. So this is actually to revive a feeding puppy. You're okay with this? Fine. And then what you do is you need to administer dextrose and again sever the cord and then increase the bond. Okay, so now how much of somebody was asking me how much milk do I give, okay? So you were talking to me that when a cesarean section is happening and I need to feed the puppy, how do we do, okay? So now what we do is that the mother is...
I was asking the effect of the anesthesia.
Yeah, no, effect of anesthesia is definitely going to be there. So whether it's going to be but it's not going to be so critical in other species than in dogs. I'll tell you why. We're going to talk about it in the next slide. Why colostrum intake or milk because they have a very low glycogen reserve. So minimal starving will cause death of the puppy. That's going to come in the next slide, right? So that's why you need to focus on feeding the puppy immediately. If the mother is not there, start it on artificial milk. You okay with that? Fine. So now, how much of milk to give? This is a very, very simple thumb rule, right? The daily requirement, energy requirement is going to be 20. So you can give this to your client also. Tell him to calculate how much milk to give. Ask him to calculate this way. So what is happening is you require 20 kilocalories per 100 gram. Every 100 gram, you require only 20 kilocalories. Now a commercial milk formula contains, every ml contains 1 kilocalorie. Am I right? So that means for a 100 gram body weight, how much of milk will I give? 20 ml. Because each is going to contain 1 kilocalorie. I am going to give 20 ml. Now, the stomach capacity is going to be 4 ml per 100 grams. So, if I am going to divide this 20 divided by 4, how much I am going to give? Every time I can only feed 4 ml, I am going to give 5 feeds. 5 feeds of 4 ml. Okay, this is the thumb rule. So, as the body weight increases, you can actually keep changing the amount of milk to be given. Fine. So, now we are coming to the most important thing. Why do you have increased neonatal mortality? Okay, why? Now, this newborn puppy is particularly vulnerable because of 4 major factors. Hypothermia, hypoglycemia, dehydration, and immunological immaturity. So normally when they talk about failing puppy syndrome, they always talk about hypothermia, hypoglycemia, that's also a cause, but that's not the cause. There are so many causes, the causes are multifactorial, but all these bring about what is happening? either this condition, hypothermia, glycemia, or it is going to be dehydration. Fine. So now what happens in a hypothermia? So when a puppy is born, right, its temperature is going to be, for the first 1 week, its temperature is 95 to 99 degrees Fahrenheit, and from second to third week, it's going to be 97 to 100 degrees Fahrenheit. So it requires an ambient temperature of 80 to 90 degrees to maintain a body temperature of 97. Now that's very, very important. You need to understand. So when it's born, it's going to be cold because it's wet from the amniotic fluids. Am I right? So what we do, either the mother licks the puppy or we are going to rub it, right? We are going to rub it. And what happens is we are going to put it near the mother, or the puppy by itself is going to seek the warmth of the mother. Now in the case where the mother is very aggressive, I'm not able to, because I had 7 cesarean section, I'm not able to put the puppy near the mother. Now what's happening? Its temperature is not going to come to normal. Okay? So now this is where hypothermia sets in. So that's very, very important. Similarly, a very weak puppy, and a puppy, that's why I said it's a weak or premature puppy, it cannot seek the mother because of its inability to do that, right? And there also it leads to hypothermia. So any drop in temperature of less than 94 degrees Fahrenheit reduces the metabolism, reduces cardiac rate, depression of GI and immune function, suckling and intestinal motility. This leads to puppy mortality. Do you get my point? Okay, so the now next thing is, warming is the key to increase body temperature. So whenever you find chilling, so when people come to you with puppy death or puppy mortality, or they say this is very weak, it's not able to drink milk, the first thing you need to do is to start increase the body temperature. So that's the key to actually deal with hypothermia. So most important is you need to do a slow warming. Rapid warming is highly dangerous. So you need to do a slow warming for a period of around 1 to 3 hours. Best way to warm, have hot water bottles, wrap it with a cloth, put the puppy on it, keep turning it alternatively, slow warming over 1 to 3 hours. Now you need to be very careful because the skin is very, very thin. So burn injuries are highly possible when you're putting it directly onto the thing. So you can also use heating pads, you can use your, the lighting, artificial lighting you can provide, right? Now how much of light to give, that's again a big problem. So you can use 40 watts bulb, 100, 60, 100 watt bulb, that doesn't matter. At what height should I fix? 3 feet, 5 feet, whichever, it doesn't matter. Now what we normally do is that you need to have this temperature monitors. They're available everywhere, right? Have these temperature monitors, keep it near the place where the delivery is going to happen, right? And you start putting this bulb and you adjust the height of the bulb depending on the temperature that is shown there. So until you get the optimum temperature, you set your bulb fitting temperature, okay? Now always, a lot of people forget to give a non-warm zone also. So when you have a area that's for the mother to deliver, you need to have a warming zone and a non-warm zone also, because if it's too hot, you need to give space for the puppies to move. Okay? This is very, very important, right? So people forget that, and that will again, hypothermia may lead to dehydration, and that's again very dangerous, right? Fine? Okay. So now you can put it on oral electrolyte solution, or you can go for 20% glucose solution, few drops in the oral mucosa, antibiotics to block bacterial invasion, and you can go for tube feeding. Now, a lot of people go for tube feeding because the puppy doesn't have a suckling reflex. Now be very careful, because in a chill puppy, if you're going to go for tube feeding, it may lead to regurgitation and aspiration pneumonia. So very careful, make sure that the temperature comes back to 35 and then you can tube feed the puppies. Fine. Now this is for a puppy which is having an issue, right? There is a chill, something problem, and this is a protocol. So warm it first and then start doing the rest of the things. Fine. So now we're talking about hypoglycemia. Now when a puppy is born, it cannot regulate its glucose metabolism also. So it has to depend upon liver glycogen for its energy source. Now this can be there only for a period of 24 hours. So it needs to 24 hours, right? But most of this glycogen reserve gets depleted by 8 to 12 hours itself. Within the liver, 8 to 12 hours it gets depleted, but it needs to have this for 24 hours. So it depends upon cholesterol intake. It has to depend upon the cholesterol intake for the other source of energy. It's very important, right? So that's why I said minimal starving can kill your puppy. So that's why you need to see. I cannot give you a solution. That's why I said, these are things that you can prevent neonatal death. right? I'm not saying do this so that you can avoid. No, these are things that you can actually prevent neonatal death from happening, right? So you need to maintain, so they have to depend upon the cholesterol intake or nutritional intake to maintain a euglycemia state. So hypoglycemia, how does hypoglycemia occur? Malnutrition of the mother, okay? Poor glycogen reserves at the birth due to either multiple pregnancy of the mother or due to malnutrition. Maybe there is some kind of glycogen storage abnormality within the puppy itself that's causing hypoglycemia. Low birth weight. Now, low birth weight puppies will have the liver will be smaller, right? So automatically glycogen reserve will be smaller, rapid depletion is going to happen. That will lead to hypoglycemia. And again, failure to suckle, it leads to rapid depletion of glycogen reserves, leading to hypoglycemia by day 2. Okay. So how do I manage this condition of hypoglycemia? Immediately, you need to address it by going for 5% dextrose in RL at the rate of 1 ml per 30 grams subcutaneous. Or I could go for oral, right? Apply some drops of 10 to 20% of glucose, 0.25 ml per 30 grams in the oral mucosa. It helps to increase the glucose concentration over critical limit. Now, how do I check the glucose? You can collect the blood sample either from the jugular vein or from your ear. Okay, and then what you do is you check for blood glucose levels. Any level less than 30 to 40 milligram per deciliter in a newborn up to 2 weeks of age is supposed to be hypoglycemic. You're okay with this? Fine. Now we go for hydration. Hydration, almost 80% of the puppy is made up of water. So rapid hydration is going to take place, right? Okay. So now also the renal immaturity, because of renal immaturity, it cannot conserve the water so much. So that again, dehydration is a very, very common aspect for death of the puppies. So what we do is, we need to actually again immediately start it with 5% dextrose. The dose is the same. Like the previous slide, the dose is going to be the same. But what happens here is, how do I calculate dehydration? So we normally talk about, elasticity, mucous membrane and all that, but it's very hard to do in a newborn puppy. Okay? Now you need to look at the tackiness of the mucous membrane. It's very hard to do because already the mouth is very small and then it's constantly suckling. So there again, that's very hard to do. And again, a lot of puppies are born with very loose skin, right? So if I'm going to pull and look for elastic, it's not going to happen. Eye mucous membrane, because eyes don't open until 14 days. It's very hard to do a person dehydration. So what we can do is collect the urine sample. Very easy in a puppy because what you do is rub it, moisten the cotton, rub just above the, the penile region or the vulval region, just below the umbilical region, just rub it. It tends to urinate, collect it, look for the specific gravity. Urine specific gravity of more than 1.030 is indication of dehydration. Fine? Then you can start supplementing with this. And finally, with the immunological immaturity. This is also very important because usually what happens is from the mother, placental transfer of immunoglobulins, that is IgE. Okay, it happens. Now, but majority of this IgA gets transferred only through cholesterol. Because the molecule size is big, it gets transferred only through cholesterol. Now the puppy is going to be dependent on passive transfer of antibodies through cholesterol. Now what was transferred, this IgG transferred from the placenta, that is going to be there only for 2 weeks. After which, the puppy now has to depend upon the cholesterol antibodies for passive transfer. So if the intake of cholesterol is not going to be there, it's going to be affected, okay? Either because of maternal behavior, improper suckling reflex, or if then again the quality of the cholesterol depends upon the mother, the status of the mother, okay? There again you have a problem that's all going to affect the passive transfer of immunity. So inadequate intake leads to failure to transfer passive immunity, very, very high mortality. So this puppy after 2 weeks it gets prone to a lot of infections because sufficient amount of passive transfer is not there. Right? That's also a cause for mortality. And so finally, time
You have to move to the next lecture
after this. Yeah, okay. Right, fine. So we go on for fading puppy syndrome, just 2 slides. Okay, now as far as fading puppy is concerned, we generally use this term for puppies that are apparently normal newborn which fails to thrive and dies in the first 2 weeks of life, right? Factors are multifactorial. I'm not going to talk about factors. Everything that is I've spoken about right now is a factor for a fading puppy syndrome. right? But whatever is the factor, including dystocia, prolonged dystocia which causes hypoxia, that's also a cause for it, right? Low birth weight. Now all these are causes. Now, whatever is the cause, the puppy is going to enter the fatal cycle of hypothermia, hypoxia, hypoglycemia, dehydration. And that's going to lead to mortality, right? So there again, I'll just talk a little bit on neonatal septicemia, right? A lot of time people will bring puppies to you, constantly crying, abdominal bloating, they'll be there. And what will happen is sloughing of the extremities, all little bit, almost necrose, sloughing of the, this happens within 2-3 days, right? Okay, it happens very quickly. And this is a classical example of neonatal septicemia, right? So where it's very important we put the puppy on an antibiotic. Most important is going to be a cetirizine, which can be given at the rate of 2 mg per kg subcutaneous for 5 to 14 days. It's available in the market for dogs. This is going to be your dose. And this alters the normal intestinal flora motility and again effective against causative organisms. Then the rest, warming and fluid supplement, that all goes without saying. Fine. And herpes virus, again one more thing, just a point to remember that when you have symptoms, apart from this anybody talks about nasal bleeding in the puppies, it's a classical example of a herpes virus. Now once herpes virus happens, it's very difficult to treat the condition. There are reports of chances of trying recovery by going for acyclovir, okay? You can go for acyclovir administration, oral preparations are available. So at the rate of 10 mg per kg, every 6 hours for 5 days. Fine, you can go for this. There are chances that these puppies can come out of a herpes virus. Now chilling. Now this is why I wanted to talk about herpes virus for the simple reason is that people say, no, I have my puppy in AC room. Already I told you, it cannot regulate its body temperature. And chilling causes rapid multiplication of herpes virus. Okay, so that's very detrimental. So make sure that they don't have the temperature is a good focus point for the client. Okay, now forget about this. And last, you can treat orphan puppies by going with plasma. You can treat them with plasma or serum. Okay, from a vaccinated dog. Okay, a healthy dog, and you can go for 16 ml, you can feed it for 3 times. 3 times, you can go for first at birth, then again 12 hours, and again after 24 hours. Now for healthy newborn, you can repeat it at 5 to 14 days of age and again at 3 to 4 weeks of age. Now if it's going to be a very sick neonate, you can still again do plasma or serum plant, this one, oral, but more frequency is important, right? Okay. So thank you so much. Take it off from your mind. Just think that I didn't talk to you anything about canine because feline reproduction is a totally different aspect. That's why I never do felines and canines together because it's so confusing, right? You give so much of data on canine and then now you say feline and then again there's so much of data that's going to be pumped in, which is so different. So when you talk about small animal reproduction, dogs and cats we say, right? But cats are totally different from dogs. Please remember that, right? Now, what happens in a cat is that, they're so highly prolific breeders. One cat and an offspring you left to breed, it will give rise to 2 million cats in a period of 8 years. I'm talking about everything is allowed to breed, right? The cat and the kitten, she's allowed to breed and it gives rise to 2 million cats over a period of 2 years. So that's so prolific they are. Then why do you need to talk about breeding in cats? I don't know why, okay? So that's how it is. But recently statistics show that almost by 2023 you will have almost nearly 2.4 million cats in India itself, right? And day by day it's increasing. And with this, a lot of people are going into breeding cats, maintaining catteries, right? So this is where problems. So with maintenance, with all this comes the problem of breeding, and that's why people approach you now for a knowledge on the basic cycle and things like that. Fine. So what I will be covering for the next 45 minutes, I'll be talking about the feline estrus cycle, breeding, pregnancy, parturition, and pre and postpartum conditions. A couple of, just a few. I can't touch because 45 minutes and I'm really rushing for time. So, I said every aspect of feline reproduction is totally different, starting from the anatomy. So, vulva, when you take the female cat, queen cat, the vulva is actually very small and you don't see an edema of the vulva as you see in a dog. You don't see bleeding in a cat as you see in a dog. A lot of times people, they don't know this. So when they see a cat bleeding, they think this cat isn't healed. Okay, you need to understand cats don't bleed. If there is a bleeding in a cat, either it's an abortion or it's a case of cystitis. So it's very important. Please remember that. Okay, now tomcats. Now what's the difference with tomcats? Now the penis tomcats are supposed to be, cats are basically induced ovulators. Okay, they require copulation for an ovulation to happen. And what causes this ovulation? The penile spines which are going to be there in the cat. This is very peculiar. So the tomcat contains penile spines which are arranged in rows, circular rows, and these spines are supposed to be androgen dependent. So that means when there is testosterone, these spines are there. The moment I'm going to castrate the dog, spines will disappear. They're androgen dependent. Okay, I'm going to inject testosterone for the tomcat, the spines will reappear. So they are androgen dependent. And what these penile spines is, they are directed caudally towards the base of the penis. So when there is going to be an intromission and withdrawal, what happens is spines go and actually stimulate the vagina, causing or inducing an LH surge to happen, leading to ovulation. So that's the role of the penile spines in the case of felines. Forget it, sometimes I may use the word puppy for a kitten, I may use the word dog for a cat, because I'm so used to talking about dogs. Please forgive me, consider it to be a cat, okay? So now, let's talk about the estrous cycle. Now here I'm going to talk about seasonality, puberty, stages, and I'm going to talk about pseudopregnancy. Now, cats are supposed to be seasonally polyestrous animals, okay? Now that means, during a breeding season, they keep continuing, their cycling continues. That's why we say seasonally polyestrous. During a particular breeding season, they're going to cycle continuously. And this breeding season is influenced by day length. When there is going to be increased daylight, this cat is going to go on cycling. The moment day length decreases, especially in the winter, now the cat will go into anestrus. You are okay with that? Fine? So that means the breeding cycle consists of a breeding and a non-breeding season. Now this season is going to be influenced by day length, temperature, breed and social interaction. So how this works is that, let's say the day length is short, right? The photo period of day length is short, daylight is less amount of daylight. Now that causes melatonin secretion. What happens when you're sleeping? Why do we sleep in the night? Why do you know there's a sleep time? That's because of an increased melatonin secretion. Similarly in a cat, when the day length is going to be increased, what's happening? The melatonin is going to be produced. This melatonin is going to prevent or decrease the synthesis of GnRH from the hypothalamus. As a result, less amount of LH, FSH and LH, and as a result, the cat is going to be in anestrus. You fine with this? So now, I can alter the cyclicity pattern. So a cat which has entered a non-breeding season, I can stimulate that cat to cycle by going for 14 hours of daylight. So if I'm going to artificially introduce daylight to this, so there's a lot of people do it in the cat race, right? So if I'm going to artificially stimulate by increasing the daylight, I'm going to provide artificial light for 14 hours continuously. Now this cat which has entered into anestrus will not start cycling. So that's why I said cyclicity depends upon the daylight. Fine, okay. Now, I said temperature, heat stress, it's going to affect the onset of cyclicity. And similarly, Persian cats, okay, though they are in the breeding season with increased day length, they have very irregular cycles. Whereas these short-haired cats, though there is a winter anestrus or during the anestrus season, they cycle continuously. So there again, the type of breed is also going to affect the cyclicity pattern. And again, when there's a lot of cats, close together, they have a synchronized estrus, which is very, very, again, peculiar as far as, but that's with most species. Even in females, when they say, females are in a hostel together, one female has a menstrual cycle, most of them start getting it. So it's kind of a synchronized pattern which happens, right? So puberty, onset of puberty. So now puberty can happen as early as 5 to 9 months of age, with an average of 3.5 to 18 months. Now please remember, cat she can come into heat by 3 months of age also, and she can become pregnant. So don't convince people, oh no, she's too young, no worries and all. But that's why we've seen so many young kittens getting pregnant also. Fine. Now, the other possibility is a cat can come into heat when she reaches 80% of her adult body weight. So almost when she reaches 2.3 to 3.2 kgs, she has reached her adult body weight, she can come into heat. Right? So these two parameters are important. So either the age or the body weight. So now onset of heat is influenced by breed, short haired versus long haired, season, body condition. Okay. So now optimal breeding age 1.5 to 7 years of age. Now, any cat more than 7 years, it's not that you can't breed it. What happens, the incidence of abnormal cycles or abortions, resorptions, they're more common as the cat becomes older. When it's going to be mated less than 1 year of age, again cycles are going to be irregular, and what happens is they are less predictable in their sexual behavior. Fine. So with this, let's go on to the complicated part, that's the estrous cycle. Fine. So here I'll be talking about the stages, the pattern of estrous cycle, the length, signs, ovulation, and hormonal changes. Okay. Now when you talk about stages of the estrous cycle, so normally in a dog you have proestrus, estrus, diestrum, anestrus, right? Now after anestrus, this dog will either enter, it has to enter into proestrus, estrus, it starts again. Now similarly in a cat, also you have the 4 stages, proestrus, estrus, diestrus, and anestrus. Now apart from there, you also have an additional stage which is called as the interestrus period. We'll talk about this, okay, in the subsequent slide. So apart from proestrus, estrus, you also have an interestrus period. Now this looks a little complicated, don't worry, I'll try to simplify it. Now, the cyclicity pattern, what's going to happen to a cat which is in heat, okay, depends on 3 possibilities. If she's not mated, because cats are induced ovulators, right? They require a mating for ovulation to happen. If she's not mated, what's going to happen? If she's mated and she becomes pregnant, what's going to happen? If she's mated, but it's a sterile mating, right? The tomcat is infertile or it has subfertile male, there again ovulation is induced, but what's happening to this cat? So the possibilities or outcomes or the cyclical pattern varies depending on whether mating is happening or not. Fine. So let's go to the first pattern, right? So this is a cat which is in heat. This is an anovulatory cycle. No ovulation is happening in this cat. What happens? This cat is in heat. She's not going to be mated. So what's happening? No ovulation is going to take place. Am I right? As simple, no? I'm not mating this cat. Automatically no ovulation is going to happen to this cat. So what happens is this cat will enter into an interestrus period. So proestrum, estrum. Now she's not mated because no ovulation is going to take place. She enters into an interestrus period. Then once again she enters into an estrus period. So again proestrus, estrus, interestrus. It goes like that. So a cat which is kept inside my house, I don't have a chance of mating this cat at all. So proestrum, estrum, interestrus. Proestrum, estrum, this is only going to be the pattern. So during the breeding season, which is generally between, February to October. Now during this breeding season, this is the only pattern it will go. Proestrum, estrum, interestrus, proestrus, estrus, that's all it will be there. Fine? So there will not be any other pattern in this case. Now let's go to the second case. So this is a cat which is in estrus, queen in estrus. Now I'm going to breed this cat. But the tom cat for some reason is a infertile male or a subfertile male. So what? Penile spines are required for what? Inducing ovulation. So mating results in ovulation, but since the male is subfertile, no fertilization takes place. Am I right? Okay. So this cat is not going to be pregnant, but ovulation has happened. There is going to be a CL formation, and this cat will go into a period of pseudo-pregnancy. This is either diestress or we use the word pseudo-pregnancy, where this is going to be there for a period of 35 days, after which the cat will enter into interestrus and then again into estrus. If it's a breeding season, she'll enter into estrus. If it's a non-breeding season, she'll enter into anestrus. You're okay with this? I hope I'm not complicating it. I tried to make it as simple as possible by going for all these images. It took me a long time to make you understand, right? So, this is a cat where it's been mated, but no ovulation has taken place, no fertilization happens. As a result, there is a CL formation. This CL is going to be there for 30 to 35 days. What is there in the dog? The CL, whether the dog is pregnant or non-pregnant, the corpus luteum is going to remain functional for 63, 70 days itself. But here, half the period of gestation, there is a CL for 30, 35 days, after which it will regress. So this is again giving the cat another opportunity to get mated. So that's how the cycle goes like this, right? So here, 30 days, the corpus luteum will regress. Once again, the cat will come into heat. Fine? So this is the pattern you are seeing. Proestrus, estrus, then it enters into diestrus. After diestrus, you have a short period of interestrus period, and then again it goes into proestrus, estrus. That's a pattern. Now the pattern can always change. Please remember, a cat which has not been mated at all, she gets mated, then she may enter again. It depends upon what's going to happen to the cat. Right? Now the third possibility, now this is a little complicated, okay? Now third possibility is that this is a queen in estrus. She gets mated. Ovulation is going to happen. Fertilization is also going to happen. Fine? Because this is a fertile cat. Fertile tomcat. Fertilization is also going to take place. And this cat has become pregnant now. There are two outcomes of pregnancy. Either the cat may abort or she may carry the litter to term. You fine with this? This aborting cat, once she aborts, she'll enter into estrus immediately within 3 to 16 days. Right? So usually abortion, we give time, no, nothing like that. This cat will immediately come into heat within a period of 3 to 16 days. Now this cat which is already delivered, depending upon whether she is lactating or not lactating. She may be lactating for a period of 8 weeks. This is lactational anestrus. She may not come into heat. But again, don't take it as a rule. We always tell the owner, oh no, as long as the mother is giving milk for the kittens, she will not come into heat. No, not like that. There are so many cats which come into heat immediately and they become pregnant also. You must have experienced all this in your practice, right? So that's why you have to, when you make statements, always be careful when you make statements. So this is lactational anestrus, right? Whereas for some reason, this kittens are very rapidly weaned away, right? So now what happens is, this cat will come into heat within 3 to 16 days. Once she is removed from the milk, she will come into heat. Now this cat, she may come into heat, or she may have an interestrus period, prolonged interestrus period, or she may enter into anestrus, depending on the breeding season. So options are multiple for a cat. In the breeding season, mating occurs, no mating occurs, or mating may result in a CL formation or a diestrus or pseudo pregnancy. You okay with this? So it's so complicated. So that's the reason why it's very, very difficult to tell an owner when to spay a cat. Unlike in a dog, I can't wait for diestrus, I can't do all this, right? So it's very, very difficult because this queen cat keeps cycling so rapidly. Fine. So now let's go on to these stages. Proestrus is very, the act of coitus or copulation is very, it's nice because in the sense, there's so many peculiarities as far as felines are concerned, right? So now, this duration of proestrus is going to be for 1 to 2 days. Very short. And there's going to be an increased estrogen level, nearly 40 picograms is going to be there. And typical signs is this cat in heat is going to be constantly vocalization. You hear a cat in heat crying, you feel like there's a baby crying somewhere, It's an agony for you because it constantly keeps in your mind. Because you see this vocalization will be there. It constantly keeps rubbing on their legs, on all objects and all that. So basically people think, this cat is getting, there's an increased affection is shown by the cat. But actually this cat is actually rubbing off the pheromones on all the objects, on the owner's legs, everywhere, right? So this you need to understand. It's a very, the signs are so subtle, you can miss it. Most people often miss this cat being in proestrus, right? And this cat will kind of be rolling on the floor and they kind of stretch and squirm and rattle recumbency. So you see this. Very slight mucoid discharge will be there, and even though she is attracted to male cats, she will not allow the male to breed. Right? This is as far as proestrus is concerned. So estrus, this is the period of sexual receptivity. Now this duration of estrus is going to be for 4 to 7 days. Right? There's going to be peak estrogen levels of nearly 25 to 80 picograms. And this cat in estrus, it exhibits a typical lordosis behavior. That is the crouching, the thorax and the forequarters down on the floor, hindquarters are elevated, deviation of the tail. It's a typical lordosis behavior. And you can see this constant treading of her hind limbs. This is actually positioning for the male to actually mount, So constant treading is going to be there. And this cat, there's going to be an increased rolling on the floor, and it constantly, there's a monotone howling. So people who don't know that this cat is in, they don't know the signs, They assume, a lot of times you must be seeing people bringing the cats to you, saying my cat is rolling on the floor, I think she's in pain, she's in agony, please do something. So basically you need to understand a cat in heat, you would see all these signs, right? Constant rolling with monotone howls. And the tomcat is going to respond by what is called as caterwauling. We use the word caterwauling, which is a shrill howling or a wailing sound. Okay, that's actually you see that. See these cries, it's very alarming because you think there are two cats fighting, But basically you will see this is nothing but what is called as the heat cry in the female as well as the response by the male. Now this is what you see, this is called as treading, where you constant, shifting of the hind limbs. This is for position. So the cat, Lardos's exhibition, the exhibition of Lardos's behavior, and treading is a signaling for readiness to mate, right? Now we're going to go in for the inter-estrus period. Now this inter-estrus period, this is a period between two estrus periods, and this duration is very short, 7 days. And here, hormones are low, progesterone is low, estrogen is low, and the cat will return to estrus within a period of 1 to 2 weeks. Okay, we're talking about behavior in these stages, right? And during diestrus of pregnancy, this is the period of progesterone dominance, right? So where an ovulation happens, maybe there is a CL formation with or without fertilization, right? So maybe it's a diestrus or it may go for pregnancy, right? And in a non-pregnant queen, the corpus luteum will regress by 30 to 50 days. It's a 30 to 35 days. Along with inter-estrus period, it's 50 days. Whereas in the pregnancy, it's around 65 days. Right, okay? Now, forget about this. Unestrum, I said all low. Okay, it's inactive period, low hormone levels, low sexual behavior is going to be there. All this is there. Now, breeding in a cat, courtship. Okay, now males are territorial markers. Now, this is very, very important. Now, in dogs, also males are territorial, but not like cats. Cats pay a lot of attention to the territory. You see a cat urinating, how he goes into a corner, lifts its hindquarters, he pees in such a way that it's a larger area that gets marked. Okay, hindquarters elevated and larger area of marking. So that is called as marking behavior, right? He marks the territory, fixes the territory. So always take the female to the male territory, not vice versa, right? If you bring it here, what happens? The male will be more interested in marking the territory rather than the female. Now, some people get too, enthusiastic. They wipe before introducing the female into the male. They wipe the kennel, they wipe the cage, everything with some disinfectant. Wipe it all. That's very dangerous because the tomcat, I told you, he's a territorial one. He's very concerned with the territory. So when you clean off this surrounding, he may become aggressive to the female also because he's going to now spend more time on marking the territory. Once the territory is marked, then only you pay attention to the female. So you need to pay attention when somebody comes to you with a breeding problem in cats. You're okay with this? Fine. So now, this courtship is very short. It's associated with low monotone howls in the case of females and caterwauling response in the male. And this duration of courtship is going to be for 10 seconds to 5 minutes. Now, coitus. Now, this is very peculiar in felines. Now, for the simple reason is when a lot of time people will come to you saying, this female cat does not become pregnant. I introduced it to male, she did not become pregnant. You need to first know whether a coitus has happened or not. How to know? The act of coitus is so short that you will miss it. You cannot visually see it. You need to have a binoculars to really visualize the act of coitus in a cat. It's so short, so big, right? So that's why I said it's important because there is a point here. So normally what happens is, during coitus, the male, the first act of coitus is, it's called as a neck bite, okay? Where the male will approach the female, achieve what is called as a neck bite. He grasps the thing. How much of time?
Please continue.
No, I can't do that. That's not fair. 10 minutes.
Take another 10.
10 minutes. Okay. Now this duration of the male approach, so it takes only just a few seconds. 30 seconds for 4 hours for a tomcat to achieve this neck grip. So this is the first act of coitus. He has to achieve the neck grip. And if he is inexperienced, okay, if he is an inexperienced male or because of stress conditions, If he is not able to achieve this neck grip, he cannot do a coitus. So that's again one thing. So now the coitus is very short. It just takes around 0.3 to 8 minutes for positioning, threading by the female, and just 1 to 30 seconds for intromission, ejaculation, and then again 0 seconds for dismounting. Okay. Now the cat has to be quick, male cat. He has to immediately have an intromission and ejaculation. He has to dismount. He has to move away from the queen quickly. Otherwise, he gets thrashed by the female. Okay. Now the moment the coitus is over, why you have the female? You have because of the spines. Okay. When the penile spines, when the penis is going to be withdrawn, what happens to the spines? They're going to go and pierce the vaginal wall, which is going to be painful for the female. She emits what is called as a coital cry, and immediately what she will do is, this is the after reaction. So this is the only indication that a mating has taken place in a cat, is the after reaction. She immediately start rolling or thrashing on the floor, okay? Rolling, thrashing on the floor, then she'll get up, she'll start licking her vulva, vagina, then again she goes rolling and thrashing on the floor. If the male attempts to even approach her, he's going to get thrashed. So he'll sit far away and he'll keep watching the female, okay? And he keeps trying to come near her. If he doesn't allow, goes back. That's called as the refractory period. So throughout the refractory period, what the male does, he'll be aware, watching the female, waiting for her to accept him. Once he gets a neck grip, again he starts to coitus. Okay. Now cats, I told you, are induced ovulators. They require coitus for ovulation. But a single coitus is not enough to induce an LH surge. Repeated coital stimulations are required for you to increase the LH levels to a level which may induce an ovulation. You're okay with this? Fine. So I told you the LH surge coitus triggers ovulation, and again it's important the date. So on the first day I may have 4 matings, but still ovulation may not be induced in all the cats. But on the second or the third day, the number of matings, that's what, it's not only the number of matings, but the day in which coitus has taken place, that's going to determine whether an ovulation is going to happen or not. You're fine with that? So always we say on the second, so a lot of times people what they do is they leave it for one day or 2 days, they'll remove the female cat. But you need to understand, you need to allow the cat female to have multiple matings, because only on the second or the third day, the more the matings, more will be the chances of an ovulation happening. Okay. Now you can artificially induce ovulation by stroking the back of the cat also, female cat. If I stroke it, possibility of inducing an ovulation. I take VC using a cotton swab, maybe I can induce an ovulation, right? I can artificially introduce a glass rod, stimulate it, rotate it, induce an ovulation in a female cat. I can also go for an injection of HCG to stimulate ovulation in the cat. Fine, okay? Okay, I'm just trying to move fast because I just have 10 minutes. I'll just go for important topics. So I can still use cytology to predict the time of breeding in a cat, as we do in the case of dogs. Okay. So pregnancy and parturition, length is 63 to 66 days. Let's not bother about the other thing. And most important sign, the first sign, or the first physical sign will be pinking of the nipples, which is the first visible sign within 15 to 18 days after mating or after ovulation. Okay. And diagnosis of pregnancy, it can be done by abdominal palpation, ultrasound, radiography, and by relaxant assay, as in the case of canines. Now, abdominal palpation again between 17 to 25 days. Now, after that, after 35 days, it's difficult to palpate, as in the case of canines. Okay? So, it's going to be difficult to palpate. Best is palpation 17 to 25 days. Now, here in the cat, you don't have what is called as the related to LH surge and all that. That's why I said white is slate scheme, because it doesn't happen in a cat. It's just from ovulation or mating. From mating, what's going to happen, right? So, ultrasonography, it's most reliable. I can do ultrasonography and I can see gestational sacs as early as 11 to 14 days. So, it's an excellent early pregnancy diagnosis method where I can use an ultrasound, see for gestational sac by 11 to 14 days, right? Now the embryo can be visualized by 15 to 17 days. I can check for fetal viability also. Now this, you need to take a photograph of this. Now, because this is how you calculate the age of the fetus based on the gestational sac diameter or the head diameter, okay? Now remember, initially when I had a formula, it was very difficult because when I was trying to work on it, that formula never used to work. Because there, it didn't tell me whether the measurement is going to be in centimeters or millimeters, okay? So that's why I said, Take this and very clearly our measurement, if it's less than 30 days, the measurements are going to be in millimeters. If it is more than 40 days, measurements are in centimeters, right? So this is a formula and you're going to calculate when you get the gestational age, days before parturition is 65 minus gestational age. Now this is another formula which gives you direct measurement of days before parturition or expected date of delivery, right? So I just take this in your thing and yeah, we'll go for this. Now radiography you can detect by 43 to 45 days and relaxin estimation you can go for 20 to 25 days of maintain. Okay. Now yeah, this and all is normal and yeah, now stage 1 parturition. Let's go for stages. This is stage 1, stage 2, stage 3. I'm not going to talk about basic parturition. But stage 1 will be associated with fetal uterine contractions and dilatation of cervix. Stage 2 is the contraction, abdominal contractions, and stage 3 is going to be the expulsion of placenta. Now what's very peculiar, this I wanted to tell you is that cats, they can refrain or the act of parturition can be interrupted if there's some kind of a stressful condition in the environment, okay? Now this cat may deliver two kittens or 3 kittens and then completely stop. Everything will be normal. So you think this cat has completed her weaning, right? She's already delivered all the kittens, she'll eat normally, she'll nurse all the kittens normally. Now what happens is that there could be a retained fetus inside. It will completely stop parturition. Now after a couple of days, it can resume again. If the condition is favorable, it can resume again and it can give birth to live kittens. Now this is something which is very, very peculiar as far as cats are concerned. Now you need to differentiate this condition. This is a normal condition, right? You need to differentiate it with dystocia. Now that's very difficult. So any client who comes to me with a cat after queening and then if there's a retained fetus, I straight away go only for a cesarean. I don't think I'll have the guts to wait for some few days till the normal parturition is going to happen. But this can happen in the cat. This is also a peculiar feature in a cat. So please just time me, no? Yeah. Okay. So yeah, it is a mammary hyperplasia, very common in cats, right? I want you to go for aglipprostone. Here I wanted to talk because aglipprostone is coming up. I want to talk about it. It's one of the best lines of treatment because you can give it for 10 milligrams. See, because these hyperplasia, they are progesterone dependent. So if I'm going to give for an antiprogestin such as aglipprostone, for some reason mifepristone doesn't work so well in cats, right? So that's why the importance is given more to aglipprostone in felines than in the case of canines, right? So aglipprostone, the dose is around 10 milligram per kg subcutaneous on days 1, 2 and 7. Now if there is an increased milk secretion, go for an antiprolactin drug at the dose rate of 5 microgram per kg per horse for 5 to 7 days. Okay. Now pyometra, okay. Now I just address 2 things. How to terminate pregnancy in a cat. Just the protocol. Take a snap of this. There are so many protocols available. These 2 are the most ideal protocols. A combination of gabagolin and chlorprostanol between 30 to 45 days of gestation. 100% I can go for termination. Again a combination of aglipprostone and chlorprostanol. In mid-term or late-term MTP, there occur complete expulsion within 55 to 80 hours. So this is again excellent protocols. These 2 are the excellent protocols for medical termination of pregnancy in cat. And the last one I want to talk to you about. Can a spayed cat come into heat or show signs of estrus? Right? Now, ovarian remnant syndrome is extremely very, what do you call it, common in the case of cats, felines, right? And now what happens is, how do I check out whether this cat is in, there is an ORS? So again we do what is called as a VEC, look for conified cells. Now I'm going to induce ovulation in this cat. If this cat is in heat, she must be having follicles, right? So I can induce ovulation by going for LH. So once I give LH, what happens is, ovulation happens, there is a CL formation. Now 2 weeks later, 2 to 3 weeks later, I estimate the progesterone levels. If the progesterone is elevated, 100%, this is a confirmed case of ovarian remnant syndrome. This cat was in heat, I've induced her to ovulate, and then I'm estimating the progesterone level to check for the progesterone. If it's increased because of formation of a CL, that means follicles were there, they ovulated, formed a CL, right? And that's a 100% confirmation that the cat is having a remnant. Please go for an surgery, spay the cat, okay? And again, as in the case of canines, you need to spay the cat during estrus or during digestrus when you have either follicles or you have a corpus luteum. Now, latest what you can do is you can go for anti-Mullerian hormone testing. This is also very, very popular, it's kind of gaining popularity. This you can give it to any human lab and they will test it. And here this AMH, what do you call it as AMH, is normally this anti-Mullerian hormone is being produced by the granulosa cells in the female as well as the Sertoli cells in the male. So, normally if there is no testis or there is no ovary, then this AMH cannot come. Am I right? Simple as that. So, any spayed cat, or if you think the testis is retained, if the male has a testis or not, you want to check that, you go for this AMH test. If the levels are there, that means ovary is there. Or, piece of ovary, right? It's functional. Because it's functional, the cat is coming into heat, right? So, small piece of ovary, it doesn't matter. It's a small piece or entire ovary, it doesn't matter. But the remnant is there, right? So, presence of AMH is indicative that there is an ovarian remnant either in the female or the presence of a testis in the male. You okay with this? So I think, thank you so much.